Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. Before I begin to narrate the video, if anyone for any reason doesn't want to hear me narrate, you're more than welcome to either turn the volume down or just simply press the mute button. And for those of you who do enjoy the audio, well, it's unaffected in that way. So, patient is a DJ and they have to have their ears de-waxed regularly. The patient also has very narrow ear canal entrances, and we're in the left ear at the moment, and on the anterior ear canal wall you'll see a bulge. Now that's you'll see it in a moment once I got this plug of wax out, and that kind of epitomizes why I'm very reluctant to use ear hooks and scoops deep in the ear, because unbeknown to me, this patient has this bulge of the bony part of the ear canal, and if we just went in with the hook, would make contact with this bony part of the ear canal and it'd be very uncomfortable for the patient. Now, the patient had been using some hydrogen peroxide drops. It's something I advise against for two reasons. Patient has got a bit of otitis externa, a bit of dry skin in the ear. Hydrogen peroxide drops is alkaline based on water. It can cause irritation to the skin, and water's never good in the ear. And it also turns the wax very mushy, hydrogen peroxide drops does, so it makes it much more difficult to vacuum. So I've just put some ear roll olive oil drops in, and you can see there's a bit of a tug of war here, and that's because this wax is lodged behind the bulge, the bony part of the ear canal. It's trapped there. Now, the patient as a DJ wears in-ear monitors, and I've just discussed with them today, trying to advise and recommend them to use over-the-ear monitors for several reasons. If you're prone to wax buildup, in-ear monitors is just going to push the wax further in. Also, as a DJ, you are exposed to very loud sounds on a continuous, constant basis, and over the years, this can damage the organ of hearing, the little hair cells, it's the sensory hair cells. Now, even with the most modern noise cancelling in-ear monitors, they are not as good at trapping out ambient background noise as over-the-ear, what we call supraoral headphones. So supraoral headphones, the ones that go over your ear, trap more background noise out of your ear, which means you don't have to have the music as loud in your ear because you can hear it over the noise. With the in-ear monitors, because they don't trap as much external sound out of the ear, you do have to increase the volume of the music so you can hear it, which over many years can have an accumulative effect and damage the organ of hearing and cause hearing loss. So for several reasons, we discussed with the patient today the best ear care for them. You can see the bulge on the left-hand side of the ear canal. So if you went in with an ear hook trying to remove this, or a Jobson horn, I would make contact with that, because I wouldn't. It's not a normal bulge. It's not going to cause them any problems per se, so that needs to be referred onwards. So just using a fine end here, just to remove some of this dead skin. Now you can see the patient's ear canal is quite dry. They don't get any itchiness, so I've just advised them to use an olive oil spray on a regular basis, just to moisturise the skin in the ear canal. Olive oil is also olive oil that we recommend. It's not home olive oil; it's medical grade olive oil, so it's safe to use in the ear. And olive oil is slightly acidic as well, and the natural pH of the ear is also slightly acidic, so you're less likely to get a reaction to it. So I always tend to recommend ear roll, which is it might be called something else elsewhere in the world. I know they are a global brand, but it's called ear roll in the UK. It's just a spray, so it's easy to instill as well. And because it's oil based, there's no water involved, so you're less likely to get a reaction. So just on the right ear, immediately I just put some drops in straight away just to loosen this, because it was a bit dry on this side, a bit dry and firm. Again, the patient's got quite a narrow ear, we're just near the entrance. I find both ears posteriorly, so when you enter the ear on the rear side, so there's a little blind spot, which is not blind with an endoscope, but normally when you look at an otoscope you wouldn't see it. Wax generally gets lodged at the entrance of the ear on the rear side, so what we call posteriorly. So if you can loosen it from there, it makes the removal of the rest of the wax much easier. So it's a large plug there, so this patient's got some wax here right on the eardrum. So just going with it, you can see the ear is quite narrow. This is a standard Zollner suction probe, and we have got some space around it, but not a lot. So it gives you an idea. So the Zollner suction probe is about 2 mil in diameter. So I'm going to put a fine end gauge now because we're going near the eardrum. So dry crusted wax superiorly. Just gently going to lift this off. Look at that view you get with the eye clear scope. See there's a few hairs there as well, so the patient has been poking in the ears. Just see it's not as dry, flaky as the other side. I hope you enjoyed that video, guys, and you're taking care of yourselves and you're keeping well. I should upload some more videos in due course. Take care and speak soon.